Good afternoon. Today we are going to discuss a case study. So patient name was Mardachanam. He was a businessman and his age was 38 years old. So when he admitted in hospital, he had a chief complaints of decreased movement in right side, both upper limb and then lower limb, and also having a history of decreasing the speech. So there's a abnormal sounds but not a exact sounds or not a pronunciation, proper pronunciation. Okay, and also he had mild difficulty in swallowing. So after admitted in hospital, initially he was admitted in emergency department. So at that time they have underwent the MRI scan and then CT scan and also blood investigations. So his, while assessing him on observation, his body build was mesomorphic. There is no any wastages in the attitude of limbs. Then external appliances, there is no use of external appliances. On palpation, there is no swelling, there is no edema, there is no tenderness. After investigation, so what they concluded or what they diagnosed was a left MCA with right side weakness. So left MCA. So MCA involves the clinical features of difficulty in swallowing, difficulty in speaking, and then involvement of one-sided movements. Because of the left MCA, it leads to the difficulty in speaking and swallowing because the broca's areas lies in the left midbrain or left cerebrum. Okay. So when assessing or examining the patient muscle power, can we able to assess the muscle power in the acute stage of stroke? No. So I can't able to assess the muscle power because in acute stage we can't able to assess muscle power. Okay. So what we can assess in the acute stage? So initially we can go with the IS center examination. For assessing the IS center examination, we have to go for GCS, Glasgow Coma Scale. So his GCS was 15 of 15. Okay. So he was a full conscious. Patient was a full conscious and he was oriented, he was attentive. Okay. So after assessing, after examining the patient, what you have to do? They have to set the management. So initially, in conservative management, he was underwent various medications. Okay, which involves the various medications which involves the anti-dialytic drugs, and then what they can do? Antispastic drugs. Then any other medicines or any other medications? Vasodilators, then beta blockers, then any other? So PAN, which is for preventing the gastritis problem. Okay, so PT management. So once we entering the PT management, we have to see for the patient current conditions. Once we enter into the PT management, for assessing a stroke patient, we have to go handle with the approach called Brainstorm approach. Okay, in the brainstorm approach, how they are classified into the brainstorm approach? The stages depends on the stages of recovery. So brainstorm calling the stages of recovery into 6 stages. So initial stage, placidity, where there is no tone in next stage. There will be a increase in the muscle tone or spasticity starts to begin. Stage 3. Further progression in the spasticity. Okay, there will be a further increase in the muscle tone. Stage 4, spasticity starts decline. And stage 4, spasticity reaches its peak. Okay, spasticity reaches its peak. Stage 5, spasticity starts decline. And stage 6, spasticity disappears. Okay, so when assessing that patient having brainstorm stages of stage 1. What is stage 1? There is no tone or placid stage. So what will be the PT management in that type of patients? Or placid. So first we have to initiate the motor or movements. So right side movements we have to initiate the right side upper limb movement and also lower limb movement. So for that what we can prescribe and what type of management we can do? Positioning. So positioning is for preventing bed sores. Then stimulus. So by giving a painful stimulus, we can able to initiate the movement. Because of the pain, the movement starts initiate. So it happening by means of the neurodevelopmental therapy. It's also called as the NDT. So what NDT means here? So neuroplasticity plays a major role. What is a neuroplasticity? So affected area of the brain is affected only. So what we are treating means we are treating or we are preventing progression of the nearby structures. Right. So what neuroplasticity means? The affected area is affected. So the function of the affected area have to mastered by the nearby structures. Okay. So that is neuroplasticity. So we have to inhibit that. We have to initiate the neuroplasticity by means of the sensory stimulus. By means of giving a sensory stimulus. Okay. So once we giving a sensory stimulus to the patient, it reaches into the brain and converts as a motor stimulus or motor response. So the sensory stimulus, applying the sensory stimulus reaches to the brain, and what we getting back? Motor stimulus. So that is what Bernstein saying that when we giving a sensory stimulus, example of sensory stimulus is a pain. When we giving a pain, automatically the patient will respond to that pain. In this case, the patient was having 15 GCS. So 15 GCS means what will be the sensory stimulus effect? Surely there will be patient will respond. Patient will withdraw his hand. Patient will respond motor movement in that time. Yes or no? So pain கொடுக்குறீங்க ஆட்டோமேட்டிக்காக அந்த பேஷண்ட் என்ன பண்ணுவோம், அது ரியாக்ட் பண்ணுவானா மாட்டானா, ஏன்னா ஜிசிஎஸ்மே 15 இருக்கு. ஓகேவா? ஸோ அப்போ சென்சரி ஸ்டிமுலஸ் தந்து ஒரு மூவ்மெண்ட்டை இனிஷியேட் பண்ணோம்னாலே ஆட்டோமேட்டிக்காக என்ன ஆகிடும், மூவ்மெண்ட் ஸ்டார்ட் ஆகும். ஸோ இன் மீன் வைல் வி ஹேவ் டு கிவ் த வெயிட் பிரீதிங் ஆக்டிவிட்டீஸ், தென் சேஞ்சிங் ஃப்ரம் லையிங் டு சிட்டிங். வெயிட் பிரீதிங்னால என்ன? வெயிட் பிரீதிங்னால என்ன? பேஷண்டோட அஃபெக்டட் சைடில் வந்து பேஷண்டோட அஃபெக்டட் சைடில் என்ன பண்ண வைக்கணும்? ஸோ வெயிட் கிரியேட் பண்ண வைக்கணும். ஸோ ஒன்ஸ் வெயிட் டிஸ்ட்ரிபியூட் ஆக ஆட்டோமேட்டிக்காக என்ன நடக்குது, அதுவுமே சென்சரி ஸ்டிமுலஸோட உள்ளே போகுது. ஃபாலோ பண்ணி நம்மளுக்கு என்ன கிடைக்குது? மோட்டார் கண்ட்ரோல், பேலன்ஸ். ஓகேவா? அது மூவ்மெண்ட். ஸோ ஃபார் எக்ஸாம்பிள், ஸோ கையை பிளேஸ் பண்ணிவிட்டு ஆஸ் த பேஷண்ட் டு சிட் டுவர்ட்ஸ் த அஃபெக்டட் சைட். ஸோ வெயிட் கிடைக்கும். ஸோ வெயிட் டிரான்ஸ்மிட் ஃப்ரம் ப்ராக்சிமல் டு டிஸ்டல். ஸோ அப்போ ஈவனாக வந்து எல்லா மசில்ஸும் என்ன ஆகுது, வெயிட் ப்ராப்பராக டிரான்ஸ்மிட் ஆகுது. ஸோ அப்போ அந்த டோன் வந்துட்டு செட் ஆகிறதுக்கு இது யூஸ்ஃபுல்லாக இருக்குது. எஸ் ஆர் நோ? ஸோ we have to give a weight bearing exercise and then the sensory stimulant in stage 0. Then automatically the patient will go for next stage. Spasticity increases. ஓகேவா? ஸோ அப்போ நெக்ஸ்ட் என்ன பண்ணுவோம், ஸ்பாஸ்டிக் செட் ஆக ஆரம்பிச்சிருச்சு. அப்போ என்ன பண்ணுவோம், அவனுக்கு மூமெண்ட்ஸ் வந்து கொஞ்சம் வர ஆரம்பிச்சிடும். அப்போ வர மூவ்மெண்ட் வந்து ஆட்டோமேட்டிக்காக என்ன பண்ணுறோம், அசிஸ்ட் பண்ணி ஃபர்தராக ஆக்டிவ் மூவ்மெண்ட்டை கன்வெர்ட் பண்ணுறோம். ஒன்ஸ் ஆக்டிவ் மூவ்மெண்ட் வந்துருச்சுன்னா ஆட்டோமேட்டிக்காக யூ கேன் கோ வித் ரெசிஸ்டட். So once the resisted exercise is started, automatically patient will get strengthened. Once patient got strengthened means he will become normal in his daily activities. Okay. Thank you.